Hi, this is Eric Durek of MedHealthFit, medhealthfit.com, and I am welcoming you to my presentation for the Southwest American College of Sports Medicine. And I'd like to bring up the talk right now and see how this is going to, let's see how this is going to run. All right, so the topic of today's lecture is the use of population health data and its importance to job opportunities and another way of looking at the profession of the exercise science community. I have been involved with population health now for the past few years. I think it is a tremendous area of opportunity for people in sports medicine. And I'm happy that the ACSM has allowed me to do this as an online presentation. I'm sorry that I'm not delivering it in person, but I hope that we get a lot of interest in it. And if you have any questions or thoughts or comments, I have all of my contact information in the last slide. So let's get started. We live in a world of data. Data is actually one of the most intriguing commodities worldwide. I remember having a conversation with a colleague once who asked me what I thought the most important commodity in the world was. Was it oil? Was it natural gas? Was it water? Was it something else? Well, these are all important. Water is obviously probably the most important things for human health, but in the world of business and commerce, data is becoming one of the most important things, especially in healthcare. And it begs the question, how important is this data to improving a person's health? How can we utilize data in a new way to actually improve someone's overall health? Now, one of the questions that I'm going to ask here is medical big data, the data that's being collected right now in the world of US healthcare, is it actually curing disease? Is it reducing the burden of chronic disease? And is it actually reducing medical costs? Lots of big questions there. But the questions that I would like to pose to the attendees of this lecture is, how can population health data, both in health promotion and sports medicine, work towards performing all of the issues that I've just mentioned? So there's three areas that I want to speak about today. The first one is data analytics. The second area on its left is the area of precision wellness, and the area on its right is medical fitness. Now, most people in the field of sports medicine are familiar with medical fitness, but I want to drill down a little bit into how precision wellness and medical fitness and the data that can be collected for both actually act in synergy to make each one a better component. Well, a little bit about me. I started my career in special populations back in the 1980s. When I came to California in 1987, I started working in a medical research center where I did clinical research in diabetes and exercise, pregnancy and exercise, and metabolic disease and exercise. So I had an exercise lab. I was very fortunate back then to be doing some groundbreaking research with some top people. And in the 1990s, I worked in a local health club here in Santa Barbara. And you can see on the picture on the left, a group of women with breast cancer who we started working with in 1994. And 27 years later, this program is still going strong at the Santa Barbara Athletic Club. And they've had the same person who I chose for the program to run it, has been doing it very successfully since that time, with almost 7,000 patients who have gone through the program. It's a tremendous benefit to our local community here. I've worked with people with renal disease, hypertension, orthopedic concerns, Guillain-Barré syndrome, many types of medical conditions, probably 9,000 to 10,000 hours of working with these types of folks. I've also been able to publish some of my work in medical studies, and over the course of my career have been involved with writing about 20 books that are related to health certifications, healthcare, et cetera, et cetera. Two of my recent publications are in population health, which I did a program for a certification agency called the Population Health Specialist. And about a year before that, I wrote a book on blood lab specialists. Both of these, I think, are going to be very important information for the profession moving forward. One of the other things I do with my company, MedFit, is I am building network provider programs for the health insurance world. There seems to be such a big renewed interest right now with health plans and integrative medicine. And I think that it's time to move from just the senior wellness programs, of which there are a few in the United States, into more of a post-rehab medical fitness provider network. My first presentation for the American College of Sports Medicine was in 1988. And happily, I received the TriSphere Sports Medicine Award back in 1991. So early on in my career, I really credit the American College of Sports Medicine and the Southwest chapter for being a real impetus for the research that I did and just for networking with a great group of people who I think have made really big contributions to the field of sports medicine. Well, let's look at big data in medicine right now. And one group that I want to really talk about first and foremost is Optum, because I, through my employer, am a customer of the Optum group. So I've been able to learn about population health through all of their emails over the years. And Optum, their transformational solutions include data analytics, primary pharmacy care services, healthcare operations, healthcare delivery, population health, and advisory services. So they lump a lot of these things together. But the students listening to this talk should understand that the use of big data for healthcare has to do with the following. And we're going to look at this on the left. This is patient retention. Medical offices and health plans want to keep patients in their offices and in their health plan. So a study that was done about 3 years ago in New York City looked at why people left one of the local health plans and physician practices. So they did a big survey. They gleaned a lot of information from their data analytics stores. And they found out that out of the 12% of people who had left, who answered specific questions, they were able to get a percentage of those people back into the original physician offices. So they were using big data to really get people to kind of stay where they're at, which is a very important part. If you're a health plan, you want people to stay in your health plan and you want to give them options in terms of doing that. So big data allows companies to look at large bundles of information and look at data on a patient's health status, both in the past and in the present, and see if there are any types of treatments, medical procedures, et cetera, that could be done that might be in the best interest of them. And perhaps they might choose one option versus another, which may be less expensive. Or they may choose some sort of an outpatient procedure versus in-hospital, which would also be cost savings. So companies like Optum use big data for all aspects of their healthcare solutions. So the next thing that I want to discuss is precision wellness. And I use precision wellness first and foremost because probably most people in the audience don't know what precision wellness is. And essentially, it is the use of specific types of health modalities to improve certain types of health procedures. And the one I have on the right is, the first one is pain management. And we'll talk about that in more detail. But going down underneath that, precision wellness can also be used for metabolic recovery. One of the things that's happening with precision management, precision wellness right now, is managing lymphedema, especially in women with breast cancer, which is one of the long-term issues and problems that oncologists face when they do breast cancer surgery. Another area which is really big in the healthcare field is brain health, whether it's traumatic brain injuries and concussions, or people who are suffering from things like autism. They're looking at brain health that is something that can be improved upon, which may not only improve a medical condition, but may also improve the ability of the aging process and reducing the affliction of certain diseases like Alzheimer's disease. The other ones that I have here are improving cellular health and improving collateral circulation. So let's dive into those things a little bit more here. So on your left, you're going to see a device called NanoV, and that's a brand name. And what it does is actually uses exclusion zone water for enhancing cellular repair. So the NanoV and other products that are similar to it are actually trying to improve cellular recovery. And what they're doing is improving the ability of the cell to produce ATP at a higher level. So from the standpoint of having a non-invasive tool that can improve ATP, I think that using exclusion zone water is fascinating. I've used it myself. All you're doing is essentially breathing in steam, and you can do it for 15 minutes, 30 minutes, or 45 minutes, and you can use it every day if you want. The machine next to it is called a PEMF, or a pulsed electromagnetic frequency. And PEMF, like books like this by Bryant Myers, have become very popular in the holistic and integrative medicine field in terms of using pulsed frequencies to enhance health, whether it's pain management, cellular repair, or just overall feelings of wellness. There are machines like the BioBalance, the Beamer, et cetera, that are using pulse magnetic frequencies. And again, these are things that people are swearing by in terms of their efficacy for long-term use. Now, most people in sports medicine might be familiar with cryotherapy. And here we have a unit where a gentleman goes in, the temperature of the unit goes down under 200 degrees Fahrenheit, negative 200 degrees, and they're there for 2.5 minutes. So cryotherapy is one of these things that first and foremost is athletic recovery and also pain management. And I think that it has, out of all of the machines that I'm going to be discussing, probably the highest face value. People know about cryotherapy, and again, people who use it swear by it. A friend of mine who had a back injury for almost a decade did just a few sessions and was pain-free for 6 months. So again, he was a health instructor, knew a lot about back pain, and again, people swear by these units. Now, is there information and research on all of these? Yes, there are. We'll talk about that a little bit later. But the machine down on the lower right is the hypobaric chamber. Now, most people, when they think of HBOT, they think of hyperbarics, which means you're actually going under sea level, and you're doing 1 atmosphere, 2 atmospheres, 3 atmospheres, etc. You stay in this metal container for up to 45 minutes to an hour. It puts pressure on the cells, and then it takes a certain amount of time to come back to sea level. Well, the difference between that and hypobarics is that you're actually going up in altitude. So you may be taken up to 6,000 feet. And in some cases, the protocols may drop you back down to sea level immediately. And I think what you're doing, you think about expanding a cell higher and higher and higher in altitude, and all of a sudden you squeeze it very quickly. And if it's a sponge, you think about like a sponge, you're soaking it with water and you squeeze it, you may be able to get that cell to actually detox or to get nutrients into the cell at a more efficient level, just because you're changing essentially the pressure both inside the cell and outside the cell. Well, the last thing I have here is compression sleeves. And compression sleeves, again, are used mostly by athletes for post-exercise performance. We have a lady here having a lower body sleeve. We also have companies that make upper body sleeves. And one of the things that I think that compression sleeves could absolutely be used very well for is lymphedema prevention and lymphedema recovery. So I'm actually in negotiations with a couple companies right now to see if they want to use compression sleeves for a very specific group of people, which would be obesity and breast cancer survivors. So I think that all of these units that we have here that are used in precision wellness centers, again, mostly for performance, have tremendous medical benefits based on the initial information and the initial research that's been done with medical-based populations. Well, who are these wellness centers that I'm talking about? Well, one of the tops in the country in California is Upgrade Labs. They have a couple centers, and they're franchising some of their work. Amplified Regenerative Therapies is in Santa Fe. They have a host of these types as well. LifeCore Group is a group out of Arizona, and they are looking at integrative medicine in general. So they're going to be doing a number of different things, not just medical fitness and not just precision wellness. They're looking at integrative medicine programs in general. So we have iCryo, which is a national program, specializes in cryotherapy. Cerulean Advanced Fitness and Wellness, which is also in Arizona, which was one of the first precision wellness centers in the United States. And then two other companies I have listed here is OsteoStrong, which is a nationwide bone health company, and Ultimate Performance, which uses a combination of performance, medical fitness, and precision wellness for their clients, and they're also an international company. So precision wellness is actually becoming more and more sort of in vogue with some of the health and medical centers around the United States. So NanoV, how you use it? Well, it usually has about 3 settings, up to an hour, can be used for aging, cancer, diabetes, and neuromuscular diseases. And most people, in talking about precision wellness, don't really understand how many sessions should you actually have. Well, a 2018 study in the Journal of Clinical Trials looked at 3 months of NanoV in Alzheimer's disease. And at that time, they had people who were diagnosed, and after 36 sessions, they essentially ameliorated the Alzheimer's disease in this small group study. And to me, this is one of those programs that screams for a larger sample size. I think that this is a machine that could really be used for a lot of different types of neurological diseases. Compression sleeves, like I say, can be used in upper and lower body, and it usually does between 30 minutes and 1 hour of compression. So what is it best for? I spoke about lymphedema, but you could also use it with people with stroke or any other cardiovascular disease. So if you look at the heart veins, vessels on the right side, this is after a number of sessions of compression sleeve therapy, where they actually improve the coronary arteries collateral circulation by up to 400%. And I think that this is a tremendous use of this technology in people who are post-cardiac surgery and people who have peripheral vascular diseases. I think that there is a tremendous opportunity to improve the circulation of the vessels and lymphatic system, and even the fascia, which we now know as our third circulatory system. So I think that out of all of the programs in precision wellness, compression sleeves are the ones outside of cryotherapy that are being really used a lot in health clubs. And I hope that they can make the switch from general sports recovery to medicine. PEMF, I think it's best for cellular detox, brain health, pain reduction, actually improves bone health and increases circulation and reduced inflammation. And I think that any type of program that does anti-inflammatory work is worth its weight in gold. I know that people are saying that PEMF combats against maybe 5G or cell phone exposure or other types of radiation sources like microwave. How it does, I don't know. How long does a person need to use PEMF? Well, most people who sell it say you should be using it for the rest of your life. But I do think that the protocols for PEMF need to be worked out in terms of looking at specific types of cellular damage and the amount of time that those cells can be reduced to normal. So anyway, PEMF also has got tremendous opportunities. And lastly, hypobaric therapies, not lastly, the use of decreased pressure to change the intracellular pressure. Some of these protocols move from altitude to sea level instantaneously, which I've discussed, and the change in pressure changes interstitial pressures. So the change allows for more oxygen and fluids to get in and out of the tissues. So most of my career, as I said, has been in the application of medical fitness to many types of populations. And medical fitness can be looked at from preventive programs, post-rehab programs, and a combination of programs for people with multitude of diseases. Most people think that medical fitness is something that's been around for maybe 5 or 10 years, but actually a gentleman named Irwin Paris, or he was affectionately known as Dr. Wynn, is considered the father of fitness medicine. He actually started one of the first medical fitness centers in Southern California in the 1960s. Cardiac rehab was started in the late 70s and early 80s, and I'm going to pay homage to the gentleman on the left, who's Dr. Neil Saul, who was really considered one of the founding fathers of cardiac rehab in the United States, and a big presenter over many decades for the American College of Sports Medicine. Neil passed away this year, a couple months ago, after a period of illness. And those of us who knew him and got a chance to speak with him at conferences knew he was one of the top people in fitness medicine from its early stages. Even back in the 1980s, Gail Weaver published a paper on how health clubs can work with the medical profession. So for the last 30 or 40 years, there has been some concern and some interest on how to get the application of exercise to people with chronic disease. Now, the industry has gone mostly the certification route, from cardiac fitness to senior fitness to cancer fitness to orthopedic fitness programs and certifications. And recently we have the MedFit Network, the Medical Fitness Association, the Medical Wellness Association, who are all developing the wellness and exercise model for people with medical diseases. So I look at it with metabolic fitness, which is cancer, diabetes, hypertension, cardiac and neurological diseases; orthopedic post-rehab, which is movement, posture, body composition, pain management, and sports performance; and diagnostics and assessments, such as biometrics, surveys, technology applications. So let's talk a little bit about technology and outcomes. You're looking at the Balance 360 portal, which looks at a number of biometrics. It looks at body composition, body water, heart rate variability. It's one of the top tools right now in the industry that's being promoted in terms of its medical applications in the health club setting. But outcomes can be physical, biometrics, behavioral, and even health surveys that people can do over a number of times, beginning and end. If their sessions could be a month or it could be a year. And I am working with a company in Virginia called Well Health, and they have just come out with a software portal that looks at pre and post assessments, daily training, nutrition, and aggregate data. And that program is called Healthy Stats, and that is from wellhealth.com. And I think that is a huge step forward in the industry in terms of the ability to collect data on assessments, training, and even blood lab data that can be all put into one portal. So that's another big area that I think is going to be in terms of the ability to sell your services to hospitals or clinics or even high-end health clubs. The ability to collect data is going to be tremendous. Because what it does is it moves the research from just the hospital and the university settings to a health club or a precision wellness center. Anybody now can actually collect data on one patient, a small group of patients, or even a large group, 50, 100, or even hundreds of patients over time. So you can put exercise physiology and research skills to use with precision health programs and medical fitness programs. And the population health really gets taken out of the hands of just the medical model, which I say is a disease-centric type of model, into exercise and health clubs, which is a health-centric model. So population health research, I think, is going to be one of the most important tools for the exercise profession, whether it's medical fitness, exercise physiology, or even health coaching. The opportunities of research, because it allows for a person who may be training groups of people to do research in the field. There was a really excellent study that came out a couple of years ago by Marshall and Groves in the Journal of Lifestyle Medicine, looking at about 350 patients with 6 or 7 medical diseases over long periods of time in about a dozen medical fitness health clubs on the East Coast. And I consider this paper to be probably the first population health study that was ever done in a health club setting. And I give great credit to Marshall and Groves for the amount of work that they put together on doing that. Number 2, it expands your clinical expertise. You get to work with precision wellness modalities, if that's what you have, as well as medical fitness for a number of different types of health conditions. So the data analytics can actually be sort of cross-platform. And it also allows for franchise opportunities. And it doesn't necessarily mean that exercise physiologists are going to go out and buy lots of health clubs. But if we look at facilities like OsteoStrong and Stretch Lab, which are franchise locations, it allows people to actually do population health research in a number of different facilities as opposed to just working for one group at a time. So it promotes medical fitness, it promotes precision wellness, and it performs the collaboration of research among a number of different types of locations. So in the last couple minutes that I have here, I want to say that data is as only important as how it's used. In sports medicine, students, practitioners, and professionals are trained in research, which I think is an extremely important area of developing healthcare relationships. I know that certain types of healthcare professions right now, they have concentrated on their clinical aspects and they have not concentrated as much on the research. I still think that most exercise physiology programs in the United States concentrate on research first. So being involved with population health management allows the practitioner to do data analytics as well as the medical fitness skills. And I think it's very important. And I'll take the students back 27 years ago when I started the cancer program. I developed and I collected research data, health data from the very first week of the classes, and I followed some of these cancer patients' health status for over 10 years. So it can be done, and I think that the population health allows students to think differently on how they're doing exercise programs. So I appreciate the ACSM again for allowing me to speak. My contact information is here, my email and my phone number. I'm more than happy to take information from anybody. I would be more than happy to have a discussion with anybody about this, because I think that we're about ready to take a very big step in the industry towards data analytics, population health, and really collaborative efforts with a number of different areas of healthcare based on some of the situations that we're seeing just this year with changes and big shifts in healthcare. So my name is Eric Durak, and I really appreciate the time that you have taken to listen to this talk, and I hope that we get a chance to have some questions on this. Thank you very much for your time.